also been a commissioner for about 5 years. 2 days a week I see patients in Robert Derbyshire, and then the rest of the week I do different bits and bobs. Commissioning is actually quite boring, really. It's a lot of data, it's contracts, it's finances, and it's quite dull work, really. But the one thing that I've loved doing over the last few years is going out and seeing the third sector. And I know, I've been to visit various different people over the years, and it's lovely. It's the one thing that kind of reminds me why I'm doing the commissioning job. Because it's at the third sector, it's actually I'm made to feel really welcome. And it's only when I've been out to a third sector provider I've been given carrot soup from a lunch. It's that sort of level of thinking and care I think is what the third sector excels at, and what I love seeing. It's the colours on the wall. It's the welcome. I just think it's so exciting. It's so much more life enhancing than the data sets that we often end up looking at Parkway. So that's why I'm really excited that we can start to work with you and offer you some actual hard cash to put all those exciting ideas that I know you've probably got, and you've had ideas sparking for goodness knows how long. Well, here's your chance. There's actually going to be a little bit of money coming potentially for those ideas. So as you've heard from everyone, we wanted all the providers for the IAP services to show you that actually they do work together very much now. But what we're wanting you to consider with the grant aims, so we've talked very much about the social inclusion element of the grants, and I think this is very much your strength, getting to places where we just don't get to. In terms of IAPT to me is really, really important. I think what Jane said was important. Medicines, and I talk as a GP who dishes them out on a daily basis, medicines are not the answer. They're not often the only answer, they're not even often the main answer. And I think psychological therapies for me is really, really vital. And it's been great. It was Lord Lanyard that started the whole IAPT process. And I think people hear a lot about the term IAPT. I think we must remember what this is. This is improving people's access to talking therapies, to building relationships, and to being able to discuss their problems. And as we've said, the two main providers, Self-Help and Manchester Mental Health Social Care Trust, are working at that step 2, step 3. What we're wanting is you to be finding people for us that don't know what psychological means, couldn't spell it, don't even necessarily think they have a mental health disorder, or wouldn't conceptualise mental health in that way. But we all know that they're out there. It's the people who can't sleep properly, and actually that's probably digging down and down and down. There's anxiety going on. It's the people who wouldn't be able to say, oh, I'm depressed. Maybe their culture doesn't actually have a word for depression, but actually they're sobbing all the time. I think of the lady who I have on an annual basis. She had a child who was stillborn, and on an annual basis she comes into me with her heart aching, and that's the word that she uses. I sort of say, oh, maybe you're depressed, but that word doesn't resonate. She doesn't know what I'm talking about. She's talking about heartache, and that's much more what the language she's using. So those are the people, those 80,000 people that we want you to be finding. Those people that don't use the language of mental health, wouldn't expect to be referred to a mental health service, wouldn't conceptualise what's happening to them necessarily as a mental health issue, but we probably see that it is, and that actually that relationship, that psychological therapy, that talking could be an incredibly powerful element of their recovery. So those are the patients we're wanting you to go out and find, and I think we do want you to be as creative as possible, because these are not easy patients, not slipping into GP role, sorry, not easy people to find, because they, as I say, they don't come forward with a t-shirt saying, oh, I've got anxiety. At the moment, we're dealing with the students, so they're all coming in because they've vomited before their exam and they're going to fail and life's a catastrophe and they can't possibly go. So they're not talking about anxiety, but to me they are. They're talking about adrenaline overload and they're struggling. So it's finding those people where they are with the difficulties they're having and recognising that connection, that actually psychological therapy may help with that. Whether you're considering providing some of that psychological therapy, or maybe you're doing a facilitative role, or maybe you're even taking a bit more of a strategic thing and building bridges for us that we struggle. So maybe, we don't necessarily want you to provide all the therapy or even consider that. We want you to build those bridges and see how we can how those bridges can be built with different providers, so that university students, as I say, people who attend mosques, different groups that wouldn't necessarily come to our attention or come to the attention of the psychological therapist. And also, it's empowering those people to think, actually, I do want that therapy. Because one of our big problems with IAPT is we do have quite a high dropout rate. And I'm convinced that is because people haven't quite understood why they're there and what they're there for. And so that's, again, is another element of trying to get people to understand what's going to happen to them when they get there and why that might be important. Also, it may be supporting people while they're doing the therapy, because actually therapy is quite difficult and can be quite challenging for some people. So it's all the different ways, the different people, it's using your creativity. The one thing I would say about IAPT, it is a target for us, back to data sets. We do need, if people are thinking of actually providing some element of psychological therapies, we need it on a minimum data set provision. But myself and Jane can talk to you about that, because that's really important for us, because we get measured by the government as the number of people we can tick the boxes to say that is IAPT. So that's why we need to work with you. To be able to make as many people and many interactions as of a psychological nature, to make them count for us. So yes, also we're talking about the levels of support. I think we've sort of gone through that. And the relationships between all the different partners and sectors. I'm not going to go through this in great detail. It's the objectives of the grant. We have a certain level of objectives: equality, partnership working, social value, sustainability. That's quite an important one. Obviously, safeguarding is paramount for us. Every organisation needs to show how they address safeguarding issues. We're looking for value for money, obviously. We would like user involvement and empowerment as well. That's a very key part of any bids. So this is the one team that Jane was trying to explain. It's still very in its early days. We're not quite sure what it's going to look like in terms of hubs or people or activities, but this is the geographical areas. As GPs, we are very much working in our localities already, and I think it won't be too difficult for us to extend that to health visitors, district nurses, palliative care. It's a little bit about estates management, but actually as GPs we're already working quite closely in our little localities. And this is the concept of the 1, 3 and 12. And it's just important that you're mindful of it, because I know you won't work in those geographical boundaries. So it may be that you will cross lots of them, or it may be that you'll actually focus on one particular area. But if you are focusing on an area, it's important to sort of work out where that one team is going to be located and based. So I think this is what I've just been saying about the IAPT, just improving access to psychological therapies, which is very key for us. I think I've talked through most of that, haven't I? Long-term health conditions, that's another area that psychological therapies is quite important, but people may not see that they might recognise that they have diabetes or
problematic, problems with a stroke, but they may not see that they also have mental health issues that could be addressed. And then the other bit that we're wanting is obviously people with serious mental health issues to gain access more comprehensively across universal services. So when I'm talking about serious mental health, I would be thinking about the psychoses, but also things, people with Asperger's, maybe some of the more behavioural difficulties related to mental health, who they may struggle to access universal services. That's another of our sort of key aims for this grant money. So I think it's exciting. It's exciting. I'm very excited to see what's going to happen. I'm convinced that you will have lots of ideas. I think you're probably already scrolling them down and thinking. But I think another key thing is that we're wanting people to work across their own areas, so maybe with different third sector providers, but equally with the different sort of more statutory providers, the Manchester Mental Health Social Care Trust and the self-help as part of the IAP service. So yes, looking forward to reading your bids when they come in. Thank you.